Melasma should be managed by controlling triggers, not through aggressive treatments. It is a chronic and recurrent condition that requires a consistent and gentle approach. Inflammation plays a major role in worsening pigmentation, which is why harsh procedures can make it worse. Geneo X supports gentle epidermal renewal without compromising the skin barrier. By providing controlled exfoliation and oxygenation, it improves the penetration of depigmenting actives applied afterward. At the same time, it helps reduce inflammatory stress, creating a more balanced skin environment that is essential for effective melasma management. Therefore, modern melasma management has shifted from destruction to regulation. The goal is to control triggers that perpetuate pigment production. These triggers include ultraviolet exposure, visible light, barrier disruption, chronic inflammation, and oxidative stress. Instead of forcing rapid exfoliation, we aim to support gradual epidermal turnover, reinforce the barrier, and modulate melanocyte signaling. When clinicians adopt this mindset, outcomes become more predictable. Pigmentation improves progressively, recurrence rates decrease, and patients tolerate repeated sessions well. The emphasis moves from short-term clearance to long-term control. In melasma, stability is the true clinical success metric. Melasma is a chronic relapsing pigmentary disorder driven by melanocyte hyperactivity. Melasma arises from a complex interaction between melanocytes, keratinocytes, fibroblasts, endothelial cells, and inflammatory mediators. It represents a disorder of the entire cutaneous ecosystem rather than an isolated epidermal abnormality. Understanding this complexity explains why simple bleaching agents rarely produce durable results. At the cellular level, melanocytes in melasma demonstrate increased functional activity rather than increased number. These cells express higher levels of tyrosinase and other melanogenic enzymes. They also show heightened sensitivity to external stimuli. Hormonal influences play a major role. Estrogen and progesterone receptors are present on melanocytes, and fluctuations during pregnancy or oral contraceptive use stimulate melanogenesis. Hormonal, genetic, and environmental factors all contribute to increased melanogenesis. Exposure to UV and visible light further stimulates melanocyte activation. Ultraviolet radiation activates alpha melanocyte stimulating hormone and induces oxidative stress. Visible light, especially in the blue spectrum, also contributes significantly, particularly in darker phototypes. These stimuli activate signaling pathways that increase melanin production and transfer to keratinocytes. Barrier dysfunction is another critical component. When the stratum corneum is compromised, inflammatory mediators penetrate deeper layers and maintain a chronic low-grade inflammatory state. Histological studies show increased mast cells, vascular dilation, and dermal inflammation in melasma lesions. Vascular endothelial growth factors and cytokines support persistent pigmentation. Heightened melanocyte sensitivity results in excessive melanin production, while disruption of the epidermal barrier facilitates pigment deposition. Dermal inflammation and vascular involvement also play a role in the persistence and recurrence of melasma. This multifactorial pathophysiology highlights the need for long-term combination treatment protocols to manage the condition effectively. This multifactorial pathophysiology clarifies why combination therapy is necessary. Effective treatment must address pigment production, inflammation, vascular factors, and barrier repair simultaneously. For melasma, the clinical protocol integrates Geneo X illuminate with non-ablative, non-fractional laser treatments. The initial phase consists of 4 sessions of each treatment performed in the same appointment. Each session includes 15 minutes of oxygenation exfoliation, followed by 30 minutes of non-ablative, non-fractional laser, and concludes with 15 minutes of oxygenation ultrasound. The first 2 sessions are scheduled every 2 weeks. Geneo X acts primarily at the epidermal level. Through controlled exfoliation and oxygenation, it removes compacted corneocytes, improves microcirculation, and enhances transdermal penetration of active ingredients. This prepares the skin biologically and mechanically. The barrier becomes more receptive to topical depigmenting agents, and the inflammatory load decreases. The non-ablative laser then acts deeper in the dermis. It selectively targets melanin and stimulates collagen remodeling without disrupting the epidermis. Because the surface remains intact, the risk of irritation and post-inflammatory pigmentation is minimized. From a clinical design perspective, this sequence is logical. First, optimize the epidermis, then treat deeper structures. The result is a layered intervention that respects tissue biology. This approach also improves patient comfort and recovery. Downtime remains minimal. Patients can repeat sessions regularly, which is essential in a chronic disease. Compliance increases when treatments are tolerable. Evidence from clinical practice shows that combined protocols often achieve better pigment reduction and longer remission than single modality treatments. By targeting multiple pathogenic pathways simultaneously, we reduce the probability of rebound pigmentation and support sustained improvement. The maintenance phase consists of one combined session per month to sustain the results. Oxypod Illuminate contains key active ingredients including vitamin C, kojic acid, alpha-arbutin, prickly pear, opuntia extract, and carrot extract. Kojic acid and alpha-arbutin work to inhibit melanogenesis, helping to reduce pigmentation. Vitamin C brightens post-inflammatory hyperpigmentation, and dull skin kojic acid inhibits tyrosinase by chelating copper ions at the enzyme's active site. This directly reduces melanin synthesis. Alpha-arbutin acts through a similar pathway, competitively inhibiting tyrosinase activity while offering a favorable safety profile compared to stronger bleaching agents. Vitamin C, or ascorbic acid, functions primarily as an antioxidant. It neutralizes reactive oxygen species generated by ultraviolet exposure and inflammation. By reducing oxidative stress, it indirectly limits melanocyte stimulation. Additionally, vitamin C interferes with melanin oxidation, contributing to a brighter skin appearance. Botanical extracts such as prickly pear and carrot provide polyphenols and carotenoids that enhance antioxidant capacity and support barrier repair. These ingredients help maintain epidermal resilience and reduce subclinical inflammation. The formulation evens skin tone, improves radiance, and provides antioxidant protection. Through this combination, the Oxypod addresses both pigment production and environmental stress. It supports gradual lightening while preserving barrier integrity. Geneo Illuminate is designed to target pigmentation and dull skin. It promotes gentle epidermal renewal and enhances the penetration of brightening actives. From a physiological perspective, the stratum corneum acts as both a protective barrier and a regulator of topical penetration. In melasma patients, the stratum corneum is often compacted and uneven. This irregular surface traps oxidized lipids, inflammatory mediators, and residual pigment. It also limits the delivery of depigmenting agents. As a result, even well-formulated topical products may demonstrate suboptimal efficacy if the barrier is not first optimized. Geneo exfoliation addresses this issue through gentle removal of superficial corneocytes. This process accelerates physiological turnover without triggering the inflammatory cascade typically associated with aggressive peels. The exfoliation is controlled and superficial, preserving the integrity of deeper epidermal layers. Simultaneously, the system enhances oxygenation and microcirculation. Improved local blood flow increases cellular metabolism and supports tissue repair. Oxygen availability contributes to healthier keratinocyte function and facilitates more efficient renewal. These changes create an environment where pigmentation appears more uniform and luminous. Another important mechanism is enhanced penetration of active ingredients. After mild exfoliation, transdermal diffusion improves. Depigmenting compounds such as vitamin C, kojic acid, and arbutin can reach their target sites more effectively. This increases biological activity without increasing concentration or irritation risk. Geneo Illuminate is designed to target pigmentation and dull skin. It promotes gentle epidermal renewal and enhances the penetration of brightening actives. From a physiological perspective, the stratum corneum acts as both a protective barrier and a regulator of topical penetration. In melasma patients, the stratum corneum is often compacted and uneven. This irregular surface traps oxidized lipids, inflammatory mediators, and residual pigment. It also limits the delivery of depigmenting agents. As a result, even well-formulated topical products may demonstrate suboptimal efficacy if the barrier is not first optimized. Clinically, these mechanisms translate into measurable outcomes. Patients demonstrate progressive improvement in luminosity, reduction of dullness, and softening of hyperpigmented patches. Because inflammation remains minimal, treatment intervals can be shorter, and cumulative effects become more significant over time. This treatment supports a more even skin tone and provides several clinical benefits, including improved luminosity, reduced appearance of hyperpigmentation, and lower inflammatory stress. It is ideal for inclusion in melasma and pigmentation protocols. The non-ablative, non-fractional laser utilizes a Q-switched endowed YAG system. Its primary effects occur at the dermal and structural level. The 1064 nm wavelength is absorbed by melanin, helping to break down excess pigment. This allows the device to fragment pigment particles through a photoacoustic mechanism rather than through thermal destruction. The energy pulses are extremely short. They generate rapid mechanical stress that breaks pigment into smaller fragments that can be cleared by macrophages and the lymphatic system. This mechanism offers two key advantages. First, it reduces epidermal injury. Second, it minimizes heat diffusion to surrounding tissue. Both factors are critical in melasma, where excessive thermal damage can provoke post-inflammatory hyperpigmentation. The laser delivers photoacoustic energy to the dermis without ablating the epidermis, which reduces the risk of surface injury and pigmentation rebound. It also stimulates fibroblasts, promoting neocollagenesis and improving skin texture. In addition, the treatment tightens dermal tissue and enhances the appearance of pores. Another advantage is versatility across skin phototypes. The 1064 nanometer wavelength is relatively safe in darker skin compared with shorter wavelengths. This makes it suitable for the populations most commonly affected by melasma. Clinically, it is used to target melasma, with specific outcomes depending on the settings and wavelength applied. By combining pigment fragmentation with dermal rejuvenation and minimal downtime, the non-ablative end-YAG laser provides a rational, biologically compatible intervention for chronic hyperpigmentation disorders. It complements epidermal therapies and supports a comprehensive treatment plan. In the case of this patient, a visible improvement in melasma can be observed. The treatment followed the established protocol, combining oxygeneo and non-ablative, non-fractional laser in the same session. The workflow begins with oxygeneo exfoliation. This step prepares the epidermis by removing superficial debris and enhancing permeability. By optimizing the barrier first, subsequent treatments become more effective and predictable. The skin becomes receptive rather than reactive. The second step is the non-ablative laser session. At this stage, deeper pigment and dermal components are targeted while the epidermis remains intact. Because exfoliation has already improved light transmission and product absorption, energy delivery is more uniform. Each session included 15 minutes of oxygeneo exfoliation, 30 minutes of non-ablative, non-fractional laser, and 15 minutes of oxygeneo ultrasound. During the initial phase, the first two sessions were scheduled every 2 weeks. The maintenance phase consists of one combined session per month to sustain and enhance the results. The combination of Geneo X and non-ablative, non-fractional laser offers several advantages. It supports gentle epidermal renewal without triggering inflammation and enhances the penetration and efficacy of depigmenting active ingredients. Geneo X supports the epidermis. It improves turnover, enhances penetration of active ingredients, reduces oxidative stress, and reinforces barrier integrity. This lowers baseline inflammation and decreases melanocyte stimulation. The laser addresses deeper structures. It selectively disrupts pigment, stimulates dermal remodeling, and improves overall skin quality without causing surface injury. This limits the risk of post-inflammatory hyperpigmentation, which remains one of the most common complications in darker phototypes. Together, these modalities create synergy. Epidermal preparation enhances laser efficacy. Dermal remodeling improves optical clarity and texture. Topical actives penetrate more effectively. Inflammation remains controlled throughout the process. The treatment stimulates collagen production and dermal remodeling without causing damage to the epidermis. It also reduces the risk of post-inflammatory hyperpigmentation and is suitable for long-term melasma control and maintenance. From a patient perspective, downtime is minimal. Daily activities can continue uninterrupted. Comfort and convenience improve adherence, and adherence strongly correlates with clinical outcomes.